Thank you for joining us on this TV Asia exclusive. I'm Rasha Goel, joined by Dr. Sudip Bose, an emergency physician and Iraq War veteran. Thank you, Dr. Bose, for joining us today.
Thank you, TV Asia. Thank you for having me.
Absolutely. Let's just start off with looking at the numbers. The U.S. has over 1 million COVID cases. Why do you think that we got hit harder than other countries?
There's a lot of theories on this. What we do know is that if we look back at history, let's look at SARS, for example. That's another coronavirus. What happened there? Let's look at what happened in Toronto, and I'll compare that to the United States. So essentially, there was a physician in China, an emergency physician, much like myself, who saw patients with SARS, and he wasn't feeling well, and he was probably in denial, and he went to a family wedding in the Kowloon province of Hong Kong. And at that wedding, he infected many family friends. He infected people in the hospital where he ended up, and he ended up dying actually. And he infected people in the hotel. And what happened is in that hotel, and ironically, he was in room 911, but he ended up infecting a lady from Toronto who was also in that hotel. That lady from Toronto went to Toronto and was the index case in Toronto, and spread it to emergency room staff there as well as other people in the public. So what does that mean, and how does that tie to the United States? Is that early on in the course of any disease, it's not on the radar. It's not an epidemic, pandemic yet, and people are spreading it, and they don't necessarily know they're spreading it. And I suspect that's what happened in New York and Seattle and some of these areas. When I talked to my colleagues, they were going in there and they didn't know those initial patients were COVID patients, and they got hit hard. Whereas other regions of the country had a little more protection, and in the sense that they got a little bit of a head start. And if you look at another country, for example, South Korea, they're probably the closest to a gold standard of how this was well handled. And what they did is, because of their prior experience with SARS, they were ready. They clamped down quickly. They shut things down, they tested rapidly, and then they did contact tracing. So we weren't quite as rapid as them doing that. So I think it's a combination of those things, as well as just other theories about the virus mutating and things like that. So it's a combination of a few things.
As you were on the front lines, what would your advice be to people as states are opening up? Many have already opened up, including Texas, where you're based.
This is a big source of controversy in the United States and probably worldwide now, is why is this place opening? Why is that place opening? And, I saw 2 patients today, and they were on total opposite ends of the spectrum. One patient was afraid he's going to die from COVID and didn't want to go anywhere and didn't want anything to open. And the other patient was ravaged by not making any money, losing his job, and just the mental toils of isolation. So you have 2 ends of the spectrum, and what's happening is people believe their way is correct. And when you listen to media and journals, you kind of cling on to what validates your point of view and their need to be correct. So the first thing I tell people about whether you're opening or not is pay attention to your biases. We're all biased as human beings, and what you're seeing in the news, you can be affected by that. So it's hard to come to the middle, because it's human nature for us to follow news sources that validate what we already think. So that's the first thing I'd tell people. The second thing I'd tell people is continue to wash your hands and socially distance as best possible, okay? Because from here in the emergency room, the people, not everybody, but certain people who are getting it are getting really sick. And it's not just the elderly people. So still continue to be careful. And remember, we take risks all the time. So we take risks when we get in the car and go to work. We could get in a car accident. We take risks when we decide not to get the flu shot, because we're putting ourselves at risk to get the flu and give it to others. And there are 40,000 people who die a year from the flu. So we take risks all the time, and we have to make decisions about what our personal risk is and what we're willing to do.
Well, when we talk about precautions, Dr. Bose, though, of course, social distancing is a huge part of it. Now, with beaches opening up, what is your standpoint when it comes to, can COVID be spread in the water. And same with walking. You know, I'm here in Los Angeles. We are required or supposed to be wearing masks. And there's quite a few people that I always see that are not wearing masks. So what's your advice on that?
You know, let's look at what we do know. We do know that this is a virus, and the virus enters us through either our eyes, our nose, and our mouth. That's it. So when you look at China, when they opened up pools and beaches, there was an increased rate of infection. So you could assume that's possibly from the virus entering through one of those portals or from somewhere else. So we don't have an actual study showing beach patients versus non-beach patients, but it makes sense that it can go in through your nose or your mouth or your eyes if you're in water. So what we do know is in stagnant air, it survives about 3 hours. So if somebody coughs or sneezes, that viral cloud could be hovering around for 3 hours. So maybe you could walk through it when you're going on a walk, possibly. Whether that's enough viral load to actually get you sick, we don't quite know yet. What we also know is on surfaces, on paper and cardboard, it lasts about a day, we think. And then on metal surfaces, it lasts about 5 days. And that's important because if you touch those surfaces and then touch your eyes, your nose, your mouth, you can get sick.
All right. Well, thank you, Dr. Bose, for joining us today. We really appreciate you taking the time. And again, thank you for all the work that you're doing to be out there and put yourself on the front lines. Dr. Bose, again, emergency physician and Iraq War veteran here on this TV Asia exclusive.